Place the bed in flat position. Position the client in center of the bed on her back. Place the lifter sheet under the client unless already in position. Position two caregivers on the side opposite to which the client will face. Have the first caregiver adjust the hands under the head and shoulders. The second caregiver adjusts the hands under the hips and legs. The client's hands are folded over her chest. On the count of 3, move by sliding the client's face up and in unison near the edge of the bed. Place 1 or 2 pillows between the legs to keep the hips in alignment when turned. Raise the side rails and both caregivers move to the side of the bed where the client will be facing. Lower the side rail. Grasp the lifter sheet and place the hands at the head, chest, hips, and leg level of the lifter sheet. Have one caregiver count to 3, then turn the client onto her side as one unit in a single movement, keeping the spine, head, hips, and legs straight. One caregiver stabilizes the client while the second caregiver reaches for pillows to support the back, beneath the head, and to position the arms. Placing in lateral or side-lying position. Place the bed in flat position. Position the client close to the caregiver. Position the client on the left or right side using the crossing leg method, unless contraindicated. Position in the center of the bed with the spine straight. Place a pillow under the head, extending several inches under the shoulders. Place a pillow against the back to help maintain the side-lying position. Raise the side rail and move to the opposite side. Lower the side rail. Position the lower arm comfortably with the palm of the hand facing up and pressure taken off from the shoulder by pulling it slightly forward. Extend the upper arm or flex slightly to rest on the hip or forward and placed on a pillow. Be certain that the upper shoulder, arm, and hands are at the same level off from the bed. Place the pillow between the legs from the knee to the ankles or flex the top leg forward to rest on the pillow so that the hip, leg, and foot are about the same height off from the bed. Raise the side rails. Placing in prone position. Use this with caution in placing clients. It may not be advisable due to breathing or other problems. Check with the nurse before attempting. Place the bed in flat position. Pull the patient close to the caregiver. Turn the client on their side. Move to the opposite side of the bed. Remove the pillow from the head and place across the abdomen. Lower the side rail. With the lower arm above the head, turn the rest of the way onto the abdomen. Center in the bed. Position the client's spine straight with the toes over the edge of the bed or place a small pillow under the lower legs to prevent pressure on the toes. Place a small pillow under the client's head if desired. Extend or flex the arms for normal alignment as desired for comfort. Raise the side rails. Positioning in a wheelchair. Be certain that the wheelchair fits the size of the client. Lock the brakes. Position the client's buttocks and back against the back of the chair. Do not allow the knees to press against the edge of the chair. Make sure that the feet are resting on a footrest or flat on the floor. Place the trunk in balanced position, not leaning to one side. Use pillows to support if needed. Place arms on the armrest or on a pillow placed across the lap.
Now, finally, we'd like you to just remember that when you're done positioning your client, you need to do a final assessment or a good once-over before you leave the room. Make sure that you've checked all of the bony areas for any redness or evidence of pressure. Make sure that you've applied any adaptive equipment they have, including braces, splints, prostheses, or positioning aids, and make sure that they're applied correctly. Check to see that there are no skin surfaces touching each other that may lead to perspiration and breakdown of the skin. Look again to see that all the joints are in proper alignment. Check the linens to make sure that they're not too tight across the top of the toes. Make sure that you ask your client if they're comfortable and get their input. There's many times that they may need a slight adjustment and they'll be in that position for a couple of hours. So get their input regarding their comfort. Make sure that you've got the call light within reach for the client. Return the bed to the lowest position. And finally, record each of your repositionings and any important information that you need to communicate and pass on to the other caregivers.